Glioblastoma, also referred to as a grade 4 astrocytoma, is a fast-growing and aggressive brain tumor. Chemotherapy and radiotherapy can boost cancer stem cell production and accelerate a patient's death. Where chemotherapy and radiotherapy treatments fail, turmeric was able to keep up its cancer-fighting effects. Hence, this is why turmeric extracts may beat the conventional therapies in the treatment of one of the most lethal forms of brain cancer. One research team analysed a total of 19 test tube and 5 animal studies regarding the effect of turmeric extract and their ability to fight or prevent glioblastoma. They concluded that curcumin could inhibit cancer cell growth and induce cell death in certain subpopulations of glioblastoma tumors, making it an effective therapeutic agent which should be considered as a potent anti-cancer treatment. Though the study had its limitations and further research will be needed to address bioavailability issues in humans and to find the ideal dosage, another study published in the Journal of Nutrition and Cancer discovered that it's possible to get a bioactive dose of curcumin into human glioblastoma cancer cells via oral delivery methods. From my research, a dose of 5 grams of curcumin extract should be taken daily. Its bioavailability can be increased in many ways, such as with a meal containing fat. In India, it's traditionally fried in coconut oil, or taken with biopterin black pepper extract. Circadian rhythm, your body's internal clock based on your sleep-wake cycles. Different epidemiological studies have shown that disruption of normal circadian rhythm is implicated in increasing the risk of developing cancers. In addition, deregulated expression of clock genes has been demonstrated in various types of cancer. These findings indicate a close association between circadian clock and cancer development and progression. Glioblastomas are highly lethal cancers containing self-renewing glioblastoma stem cells. It was shown that glioblastoma stem cells, differentiated glioblastoma stem cells, and non-malignant brain cultures all displayed robust circadian rhythms. Yet, glioblastoma stem cells alone displayed exquisite dependence on core clock transcription factors for optimal cell growth. Downregulation of these transcription factors in glioblastoma stem cells induced cell cycle arrest and apoptosis. This brings in the question of whether the disrupted sleep cycle could be a primary driving force in the growth of brain cancer, and if overstressed, workaholic-type people who have disrupted sleep have caused or worsened their condition partially as a result of the disrupted circadian rhythm. The research drug SR9009 was developed by the Scripps Institute as a cure for jet lag. In one study, SR9009 also reduced the growth of glioblastoma brain cancer and lengthened survival time in mice with glioblastoma tumors. It worked about as effectively as temozolomide, the current standard treatment for glioblastoma, but it did so without any of the apparent side effects, such as hair loss, gastrointestinal upset, and nervous system problems, among other effects. SR9009 and the similar drug SR9011 both pass the blood-brain barrier, enabling to reach the brain. In the trials, it was administered as injections due to questions on oral bioavailability. However, anecdotal user reports attest to its benefits through the oral route, especially when it's dissolved in DMSO and taken sublingually. As SR 9009 has a very short half-life of around 2 hours, regular dosing is needed throughout the day. When evaluating the influence of a concomitant administration of the pineal hormone melatonin in patients with glioblastoma treated with radical or adjuvant radiotherapy, a study including 30 patients with glioblastoma who were randomized to receive radiotherapy or radiotherapy plus melatonin at 20 milligrams a day until disease progression was monitored. Both the survival curve and the percentage of survival at 1 year were significantly higher in patients treated with radiotherapy plus melatonin than those receiving radiotherapy alone. Moreover, radiotherapy or steroid therapy-related toxicities were lower in patients concomitantly treated with melatonin. The resistance of glioblastoma to conventional therapies lies in a subpopulation of cells called brain tumor initiating cells, where the metabolic profile is highly dependent on aerobic glycolysis. Thus, a potential method to fight glioblastoma is by manipulating the metabolism of these cells. Reports have shown that high melatonin concentrations display oncostatic and chemotherapy adjuvant properties in several malignancies due to an increase in mitochondrial oxidative phosphorylation. Moreover, no side effects have been reported as a consequence of melatonin. All forms of cancer increase their growth rate when sugar is consumed. The metabolic profile is highly dependent on aerobic glycolysis. This is where insulin-potentiated chemotherapy may be beneficial, but at least a sugar-free ketogenic diet could slow progression and allow for extra time for other therapies to take effect. Metformin treatment inhibits the motility and invasion of glioblastoma cancer cells. The natural alternative in effectiveness to metformin, the drug used to treat diabetes and for life extension purposes, is berberine hydrochloride. Berberine can reverse the process of epithelial mesenchymal transition, a marker of tumor invasion. This work supports berberine as a putative anti-tumor agent targeting glioma cells. And berberine induces autophagy in glioblastoma by targeting the AMPK-mTOR ULK1 pathway. Standard doses of berberine hydrochloride are 500 milligrams per meal with breakfast, lunch and dinner, totaling 1,500 milligrams per day. In the February 2007 issue of Nutrition and Metabolism, researchers reported that in contrast to brain tumor cells, which lack metabolic flexibility and are largely dependent on glucose for growth and survival, normal brain cells can metabolize both glucose and ketone bodies for energy. Ketone bodies are 3 water-soluble compounds that are produced as byproducts when fatty acids are broken down for energy in the liver and kidney, and become a source of energy for the brain and the heart. A study evaluated the efficacy of KetoCal, a new nutritionally balanced, high-fat, low-carbohydrate ketogenic diet for children with epilepsy, on the growth and vascularity of malignant mouse Astrosytoma and human glioblastoma. Adult mice were implanted with malignant brain tumors, and KetoCal was administered to the mice in either unrestricted amounts or restricted amounts. The effects of KetoCal on tumor growth, vascularity, and mouse survival were compared with that of unrestricted high-carbohydrate standard diet. Results indicate that ketocal, administered in restricted amounts, significantly decreased the intracerebral growth of tumours by 65% and significantly enhanced health and survival relative to that of the control group receiving the standard low-fat, high-carbohydrate diet. An anecdotal report. A glioblastoma multiforme 4 brain tumour is often called the Terminator by doctors because of its low survival rates. One patient was given a year to live with this diagnosis. However, after transforming his diet, his tumour began to shrink, and this year doctors say there's almost nothing left of the cancerous mass. The man decided to eliminate all carbohydrates, sugar, and most fruit and vegetables from his diet. Instead, he filled up on more meat, dairy, and fat. His game plan to fight cancer is based on the principle of the ketogenic diet. Many people believe that following such a diet can help fight cancer by cutting off the tumour's primary energy source, sugar. Of course, many mainstream medicine practitioners do not agree with this diet and insist that there's no evidence to support such a claim. However, the patient's very existence and the diminishing tumour in his brain should certainly suggest otherwise. Along with melatonin to help sync up the circadian rhythm, a high dose of CBD before bed would also be advised. A dose of 200 milligrams per day could be taken. A study has shown that cannabidiol, CBD, slows cancer cell growth and is toxic to human glioblastoma cell lines, presenting a possible treatment. Findings from a new study examining human and canine brain cancer cells suggest that cannabidiol could be an effective therapy for glioblastoma by research that was conducted at Colorado State University. Some other alternative advice to sync up circadian rhythms is to walk barefoot to ground and neutralize positive ion buildup in the body. A grounding rod connected to an electroconductive mat attached to your bed could also help this during sleep. The neutralizing of positive ions can be enhanced by high doses of liposomal vitamin C for its electron donor capabilities. A device such as the SOTA BioTuner on mode 3 for 2 20-minute sessions a day may be of benefit, as they have Schumann frequency harmonics that resynchronize the brain's circadian rhythm and normalize all neurotransmitter levels. Getting up when it's bright and going to bed when it's dark, removing UV light interference at night, and any source of electromagnetic radiation, such as a mobile phone, from your room, and using blue light blocking glasses. The increasing instances of highly dangerous type of brain cancer in the UK show the cases of glioblastoma multiforme more than doubled from 1995 to 2015. The authors of the UK study believe that widespread environmental or lifestyle factors, such as the increasing use of cell phones, brought about this startling rise in brain tumours. Cell phone radiation is also known to disrupt melatonin production and interfere with circadian rhythms. Ensure complete darkness in the room to not disrupt the melatonin conversion. Prescription SSRI medication further interferes with melatonin production and circadian rhythms. These can often be unnecessarily prescribed when someone is undergoing a stressful life situation, such as a cancer diagnosis. Glioblastoma, the highly malignant type of brain cancer that John McCain had, may be very difficult to treat, but it's inaccurate to say that nothing can help. It was pointed out in studies going back to 2007 that eating raw garlic releases organic compounds that kill brain tumours. In fact, a study reported by the National Health Service in the UK showed that consuming raw garlic successfully killed glioblastoma. Overheating garlic will kill beneficial compounds. The best way to get garlic's health benefits is by ensuring that it's chopped or broken down beforehand and consumed raw. It's a good idea to let it sit around for 15 minutes after crushing it so the allanase enzyme can be released. This is what causes the brain-protecting organic sulfur compounds to form. Consuming 5 grams of L-arginine and 5 grams of L-citrulline on an empty stomach, either each morning or evening, may be of benefit. Arginine supports healthy immune system response to fight brain cancer. Neutrophils become desensitized to the persistent systemic inflammation and become less responsive to disease-causing agents. Cancer cells thrive in an inflamed cellular environment, and if left unchecked, lead to the destruction of healthy tissues and tumor formation. Neutrophils stop the immune response by secreting an enzyme called arginase. After they secrete arginase, commonly they die and are excreted by the body. Researchers have found that patients with glioblastoma do not exhibit the normal neutrophil-mediated immune response, and cancer cells grow and spread unabated. Scientists from the University of Colorado Cancer Center found that T cells are critically dependent on arginine for activation and function. They were able to determine immune system response is not only dependent on an increase in arginase, but rather the resulting lack of arginine suppresses the immune system. The researchers concluded that persistent arginase production from neutrophils suppresses the immune system and keeps cancer cells from becoming immune targets. A phase 2 clinical trial of a product called AT101, a pill made from a potent compound found in cottonseed, appears to overcome the out-of-control growth pattern of malignant cells. So far, in clinical tests, the AT101 stopped the usually lethal brain cancer progression in many of the 56 patients treated. Before the trial began, patients in the study had already undergone standard treatments, including brain surgery and chemotherapy, but their aggressive brain tumors had started growing again. The cancer research subjects were then given a treatment consisting only of AT101 daily for 3 out of 4 weeks. After getting this drug, some of the patients went many months without any new growth in their tumors.